Hello, I'm Mindy Estes. Joining me today is Greg Bentz, Chairman of the Board of Directors of BJC Health. Greg is a trial attorney, a board leadership fellow, and immediate past chair of the American Hospital Association's Committee on Governance. He's also served as the chairman of the board of the St. Luke's Health System and has held numerous leadership positions at St. Luke's since 2005. Under his leadership, St. Luke's has emphasized investments in patient safety and quality, continually adapting operations to meet the evolving needs of the community. Our goal today is twofold. We'll delve into how boards can effectively address patient safety, foster a culture of safety, and explore specific instances where board decisions have advanced patient safety or workforce safety. Secondly, we'll also discuss how boards can utilize quality and safety data to drive meaningful change and to develop strategies for effectively engaging the board in these efforts. Greg, it's great to have you here. And as you know, the American Hospital Association is supporting the safety improvement work of its members by focusing on ideas and strategy to further the foundational areas that underlie all safety improvement. Ensuring a culture of safety, ensuring equity of care, and protecting the well-being of the workforce. As an experienced board member and chair, how would you describe the board's role in addressing patient safety?
Thank you, Mindy. I always have the same starting point. My starting point is that quality, care, and safety has to be the board's true North Star. It has to drive their decision-making. Every decision that a board makes should be seen through the lens of how does this decision impact our ability to provide our patients with the highest quality of care. The board obviously has a role in setting the culture, setting the priorities, and in order to do that well, there has to be open and honest discussion between boards and management. Obviously, boards have a fiduciary duty to oversee quality and safety. They now also have a regulatory duty under the CMS QAPI program. And all of those things have to be kept in mind by the board as it's doing its business on a day-to-day basis. I have always thought that it was important that quality and safety be a top of the agenda item, not just top of mind, but literally top of the agenda. I've worked to try and get quality discussed earlier in meetings so that it doesn't get buried in the last 5 minutes of a board meeting. Certainly, the board has to provide the resources necessary for quality and safety to meet its highest and best use. And the full and transparent communications between board and management helps provide that information so the board can do what it needs to do. The board also needs to be educating itself. It needs to be staying up to speed on the quality and safety issues of the day. And that starts in recruitment. It continues through orientation. And it's important that the board members be given enough education so they have a quality framework so they can do their job properly.
Greg, I just wanted to pick on something you said, a full and transparent communication between the board and management, because often the board members, you have a insight and window into the community that management doesn't have. It's a very different way. You hear things that we don't hear, things that we need to hear. And that trust and that communication, I think, is really pivotal. And certainly that's something that you have advanced in all of the boards that I've seen you chair. So thank you for that.
Thanks. I agree, Mindy. It's really important that the board be able to be in a situation where they can provide feedback to management about what's going on in the community and also be educated enough so that they can advocate in the community as well.
I want to move on to, you've chaired the board of St. Luke's for many years and now the board of the big organization that was created by the St. Luke's BJC merger. Could you talk about an instance when you saw a board play a pivotal role in advancing patient or workforce safety? I mean, what did they do that helped create needed change that others might want to emulate? And if there's an instance where you can think of that a non-clinician drove a process or improvement change that really focused on patient safety and quality.
Sure. Uh, there was a time at St. Luke's South where we were focusing on the concept of a high reliability organization. And we were preparing for a joint commission survey. We were thinking about reliability. We had an admiral actually spoke to us about aircraft carriers and how they have the procedures down so close because of the need to make sure there's not a loose screw someplace that might get into a jet engine or those types of issues. But we're making a big quality push and a big reliability push. And Lloyd Hill, who is a businessman here in the community and was in the restaurant business and was the CEO of a large national restaurant chain, really understood the concept of reliability, the concept of how procedures put people in place to be successful. And Lloyd and I worked together, and we really had some discussions along with Bobby about some significant efforts to move the board past just receiving the statistics. And instead of just receiving the statistics, asking the question, how are we going to improve this? How are we going to get better? How are we going to solve the trend, which may not be as positive as we want it to be? One of the things that we did out of that discussion was create a quality committee. And the quality committee is a great vehicle for asking the why questions. How do we improve? And it also lets the management team know that the board is interested in quality, that it's top of mind for the board, that they're watching, that there's accountability. And I think that those discussions that I had with Lloyd really helped kind of change the culture that we had at St. Luke's South.
And St. Luke's South is an important part of the St. Luke's health system. And your notion and talk about a quality committee, I think, is important because it's a real opportunity for members of the board, but also physicians and others responsible for the day-to-day quality agenda to get together and to talk and to learn. And in turn, that quality committee really becomes experts for the various boards. So I think, it takes time and energy, but the rewards are big. And I know you and I've had the conversation many times that people think sometimes it's the doctors and nurses who drive quality, but it is anybody within the organization. And in St. Luke's case, it was all 13,000 employees and our various boards who have to drive that quality agenda, understand it, and really have it as part of the institutional DNA. Now, I know when you talked a little bit about statistics, that when I was CEO and you were my board chair, we gave you and other board members a lot of information, a dashboard of quality and safety data, stories of patient harm and good catches, discussion of proposed projects, and routine updates on progress, as well as information from a large number of external parties, both regulatory and otherwise, who regulate and are interested in quality. As you think about all of that, what did you find most useful to you as a trustee and to the board, and why?
Well, I will say that the quality dashboard that we put together over time was a critical piece for me. And the thing that made it most important is that it evolved into an action document. It wasn't just giving us, here is a current static view of things. It gave us information on trends. It gave us a look at how things were doing over time. We used it to discuss why causes for these events. It was a tool that allowed us to take that information and plan on how to improve our performance, describe for the board what resources might be needed in order to overcome the issues, and it also let us determine who was going to be responsible for monitoring these issues, describing what success looks like, and determining a timetable for when the board might hear back. So those quality dashboards, those key performance indicators, as long as they're looking over a period of time, can be critical. Now, this discussion was never judgmental. It was not a discussion about laying blame. It was a discussion about respectful collaboration between the board, the CEO, the management team, and in some places, the medical staff.
It's an important point. You saying that, I don't want to know what's going well. I want to know where we have room for improvement. And most importantly, what are you going to do about it? And what is the realistic timeline? And so I think the board driving that accountability for management is critically important because, in today's world, there are so many competing priorities. And at the foundation is quality and patient safety. And it's easy sometimes to get lost in the fact that our quality data oftentimes lags. And so we're focused on what do we know today and how can we fix that. So I think that reminder and that engagement between the board and management around quality, and you're right, it has to be at the top of the agenda. Otherwise, the last 5 minutes get pretty crowded.
Yeah.
What other strategies or tools have you found in helping boards to engage in safety discussions and provide strong support and guidance for the leadership team in their own organization? What strategies would you suggest?
Well, it's critical that a board be engaged on the quality issue. They have to really care about quality. And really, if you don't care about quality, you shouldn't be in the healthcare industry or on a healthcare board. But you have to make sure that management understands how important the board views quality and safe care. There's research that indicates that an engaged board leads to better outcomes. I think it keeps people focused. And in order to keep the board engaged, there's a number of things to consider. One is education. It really starts, as I said earlier, in the orientation phase, but it has to continue throughout the life cycle of a person on the board. We have to provide them educational opportunities during board meetings and also before and after board meetings. We started using our portal to circulate new information, new articles, new discussions of the board's role in the quality process, and found that to be really helpful. I think you have to challenge a board to continue to self-educate and to want to improve their knowledge base and their quality framework. The quality committee that I mentioned earlier is a great way to engage board members, to have them work with management and the physicians that are providing care to really do a deep dive on the issues that are causing what might be safety concerns. It signals to the management team, the CEO, and the medical staff how much quality is important to the board. We've used a quality retreat, which is a retreat that is solely based on discussing quality issues. It really allows the board to get away from other issues that are certainly important, but to focus on quality, be educated on quality, take a deeper dive into the information that they review regularly. And we found that a half a day retreat on that area was super helpful, and it really got the board focused and energized about quality. The last thing I'll mention is the idea of doing a self-assessment of the board on quality. Board self-assessments are a common tool, but to do one that is solely based on how do you think the board is doing in its oversight responsibilities of quality and safety for the patients.
And Greg, it is obvious, but we can sometimes go a whole board meeting unless we're intentional about reminding ourselves that what we are doing is for the welfare of our patients and in our communities. And so assessing how our quality agenda is impacting our patients and where we have gaps and where the board can help us understand and plug those gaps, I think is a unique opportunity. Finally, just in thinking back over the years of service that you have given to your community by serving on the St. Luke's board and now the BJC board, what's the most important lesson that you have learned about patient safety and that you would want other trustees and healthcare leaders to know?
Well, I've got a couple of them, Mindy. One is, as I said before, quality and patient safety has to be the overriding and true North Star of the board. It has to impact their decisions at each turn. The second thing I want to mention, and you alluded to it, is that quality is really an issue of equity. We have an obligation to provide the highest quality care to all our patients wherever we find them. And it is critical, just in a fairness sense, that we provide everyone with the highest quality care possible. The other thing that quality care does is it allows patients and people to reach their highest health potential. And I think that needs to be an overriding thought for all of us. I will say and I mentioned this earlier, a culture of quality and safety requires trust. It requires that the board and the CEO and management and the medical staff and other caregivers trust each other, that they have a respectfully collaborative relationship, that there is not mistrust, because quality is a hard issue and it takes complete buy-in by everybody in order to meet the goals that we all set for ourselves. And continuous improvement really takes leadership, and it takes leadership from each of those groups to focus and put forth the effort for continuous improvement.
Well, and you have highlighted, and I agree completely with you. I think quality and safety is a partnership, and it's a partnership between management and the board. And, advancing the agenda of building a culture of patient safety, ensuring health equity, and protecting our workforce are all tenets of that agenda. And I would just add, we now openly talk about health equity. And if there is a bit of lemonade out of lemons from the COVID pandemic, it is, I think, brought into stark relief that health inequities exist throughout our country and exist in all of our communities. And unless you can recognize and have an open dialogue and conversation, you cannot begin to address those gaps in care. So I want to thank you, Greg. I think your examples give our listeners an opportunity to look at their own organizations and see where their continuous improvement can happen. And to our listeners, consider how your boards are enhancing patient safety and fostering a culture of improvement, and something that hasn't been specifically said, but it is clearly accountability. Accountability for management, accountability for all of us. I want to thank you for listening, and stay tuned for more episodes as we talk about the various pieces of advancing the agenda of safety and quality. Thank you all for being here.